9:24, and she's talking about Diamond going to play tennis because she's referring to Diamond Fernandez, the director of the Heart Fit Clinic. 4 o'clock this afternoon. I think you're good.
I hope so.
You're not going to have to wear your DAC boots. It would be terrible to play tennis if you had an umbrella in your head, wouldn't it?
It'd be a little difficult.
But we like to see you getting out and getting active, and that's your gig. You're the director of the Heart Fit Clinic, and we're talking about our heart, our cardiovascular system, strokes. A large part of what you guys do at the Heart Fit Clinic is you do the rehab, but is the prevention of strokes and heart attack.
And there are 4 different stages of disease that I think it's very important to know about. Everyone is susceptible to heart disease. The second stage is really the pre-symptomatic. Are you on the path of a heart attack or stroke? And the third stage is actually having the disease process. And then the 4th stage is disability. So as a prevention, we want to prevent the, stage 1 and 2 going into stage 3. And as a rehab clinic, we want to prevent disability from happening. So ideally, we like to get people before a problem actually exists.
And they can come in. So people can come in to the Heart Fit Clinic for a screening.
Absolutely.
You don't need to go through your doctor. If you're just you're interested, you're like, what's this about? Talk to me. Give me some education.
I think it's important that people know, and at the Heart Fit Clinic, we have lifestyle modification programs to reduce and reverse that disease process. The key is now we have the most accurate screening test to find out what your risk is of a heart attack or stroke. And that's done with ultrasound, so it's safe, it's painless, there's no radiation, it's non-invasive, and it gives us a good marker as to what your disease process is. So it is important to know your conventional risk factors to heart disease, such as high blood pressure, high cholesterol, diabetes, obesity. Those are ones that we can really measure. Then we get into the ones that are hard to measure, such as stress, lack of exercise, family history of heart disease. And so with the carotid IMT scan that we do at our clinic, we're able to find out really what is your risk of heart disease, and more importantly, then we can reverse that disease process.
Well, and that's the key. It's fine to tell somebody that you're at risk, but what are you going to do to help me not be at risk? And you folks can implement, can give us ideas.
Absolutely. And that's the best part of what we do is, yes, we have these screening tests to find out where you are, but then more importantly, we can help you reverse that process. So we have clinical supervised exercise programs, nutrition programs, and stress management programs to help and really have people be aware of their disease risk. Ignorance is not bliss.
Not in this case.
What you don't know will hurt you. So it's very important to understand your cardiovascular disease risk.
And we hear so much. If you're going to have a stroke, you should have one in Calgary, because we have got world-renowned dealing with strokes here. They have an amazing program. But you need to know your blood pressure. We're being inundated with commercials right now. Know your blood pressure. Know the signs of stroke. Stroke is very debilitating.
Absolutely. It's part of the cardiovascular disease as being the #1 cause of death of men and women. And it's a preventable disease. It's something that you can stop yourself from having. So it's so important to know your numbers and know your risk. And that's where our screenings are able to give people that window of what's going on inside their arteries, so you can really pay attention and start to take control of that disease process.
Okay, you're giving away to our viewers this morning some cardio assessments. How does that happen? We'll tell you how you can win one, but they can just call you guys. You're going to take them through a screening process?
Absolutely. No doctor's referrals required to do our assessments. It's when we go into the program, then our nurses will decide whether doctor's referrals are required or not. But yeah, we're giving away 50 free assessments, and that's available off of our website. We have an email form there that you can get free steps to find out how to prevent and reverse that disease process. So
information is key. Ignorance is not bliss. The website is
heartfit.ca.
Heartfit.ca could save your life, the life of someone you love. 9:28. Thanks, Diamond.
Excellent. Thank you very much.
Good luck with that tennis this afternoon. Get active, hey?
Absolutely.
Get active. Bindu, you follow me a few stories for 9:30.
Yeah, that's right.